Thank you, Mr Deputy Speaker. Too little, too late. What a joke. Both has there been significant investment in our health and COVID response, and it has been delivered in a way that I think people will look back and say it's been quite extraordinary. So let's just start with the concept of too little. COVID health funding has been quite extraordinary in the last 18 months. We've guaranteed funding for health and Medicare. Importantly, we introduced a very important measure, which was the telehealth measure, to ensure that people could see their doctors without the risk of COVID. It helped take the pressure off our PPE early in the COVID pandemic, and it was a clever way of making sure that our doctors too weren't getting sick. It was an absolute brilliant stroke, and it's resulted in 71 million telehealth visits. It's completely transformed medical care, and it's something that I think will be a legacy for many years to come. We've invested $1.5 billion for COVID-related health services, including for testing and tracing, respiratory clinics and telehealth. We've invested $20 billion to the vaccine rollout and to strengthen our health system in response to COVID. We've further invested a record $2.3 billion for mental health and suicide prevention package in the budget. And that's because we understand the shadow pandemic of this COVID pandemic. We understand these rolling lockdowns have had a significant impact on Australians, with more headspace centres to support young Australians, head-to-health clinics for those aged over 25, and greater access to medical professionals through Medicare. Mr Deputy Speaker, I'm absolutely proud that there's going to be a headspace opening in Higgins in the very coming months. But more than that, we've increased Medicare funding by $19 billion, from $19 billion per year in 2012-2013 to $30 billion in 2021 and up to $33 billion in the 2024-2025. Bulk billing rates are at a record high, 88.7% for the period from July 2020 to March 2021. So not just more funding, but making it more affordable for patients so that they can get the help they need and more accessible through telehealth. We've also delivered significant reforms to the private health insurance, and this has been incredibly important as people have had to face an economic downturn. Now, Mr Deputy Speaker, more than that, the Minister for Health, Greg Hunt, has worked very hard across the private and public health systems to ensure that there are agreements so that there can be movement of patients between these incredibly intertwined healthcare systems, and prepared last year with the intensive care beds from 2,200 increased to 7,500 in the case that we had an outbreak that we were unable to contain that was going to overwhelm our intensive care units. Now, that preparation happened at speed. So to talk about too little, too late is a complete joke. But let us turn to the too late aspect. When we think about the vaccine preparation that our government had very early on, you would think we were on different planets. From last year, Australia entered into 5 separate agreements. Five separate agreements to secure more than 195 million doses of COVID-19 vaccines, if proven to be safe and effective. Because, of course, we're not going to roll out an agreement and we're not going to roll out a vaccine that's not safe and effective. And so, for instance, the UQ investment, which was a great investment because it was going to be an Australian invention, unfortunately fell over. Well, I don't think we want the members opposite, including the member for Macarthur, couldn't possibly expect that we'd roll out an ineffective vaccine. But it is true the Australian government has invested $5 billion into these 5 agreements, including Moderna, which is coming very soon. But the Pfizer approval went through a world-class TGA approval, which was in January the 25th, 2021, after a rigorous assessment and approval process. Australia didn't cut corners when it came to safety. The same with AstraZeneca. We knew that we needed to be careful about our international supply. We knew from PPE and testing last year that when there was a secure supply issue that we needed to manufacture right here. Now, that is not something that actually we have full agreement with on the other side. Mr Albanese has been repeatedly invited, or the leader of the opposition has been repeatedly invited to encourage take-up of AstraZeneca, and he's failed to do it. So if we were to say someone has been too little too late, the Leader of the Opposition has something to answer for. But there are members on the other side that have actually supported the AstraZeneca rollout, and that would include the member for Maribyrnong, who has been very clear in his support for the AstraZeneca rollout, and he understands that we've got to talk up our vaccine, not talk it down. Thank you, Mr Deputy Speaker.
The member for Macarthur has the call.
Thank you very much, Mr